these numbers are really hard to actually pin down and say that this is an increasing crisis or anything like that, because what they really look at is the people who have been uninsured at some point in the past 2 years. So, when you talk about 17% or 1.5 million people, it's that 1.5 million people have been without insurance for some portion of time during the past 2 years. So they may have been insured through the private employer. They may have bought insurance on their own. They may have been on Medicaid at other points during that period of time. But at some point, they were uninsured. And if you take a look at the numbers, when they break it down by Medicaid and private insurance and uninsured, in this one, they just take a look at uninsured versus insured. But in other reports that the census does on it, you end up with 103% of people. Obviously, you can't have more people with some form of insurance or uninsurance than you have people in the state, but that's how the numbers kind of work out sometimes, so that you have an increase in the people on Medicaid, percent of people on Medicaid, that more than offsets the decrease in the people with private insurance, and but you still end up with an even larger increase in the uninsured. So you've got So what these numbers mean at this point is really hard to say, other than that more people were without insurance for some period of time during the past 2 years than they were in the previous 2 years. And whether that's because people were changing jobs more or anything else, it's hard to really say.